Today, we are going to look at a BodyViz brain builder about blood donations. Many patients rely on blood donations every day. In this video, we will discuss the essential components of blood and how it is donated to patients in need. Blood is a type of connective tissue made up of cells and fluid, and is the main mode of transportation for many essential substances throughout the body. Erythrocytes, known as red blood cells, make up 44% of whole blood and are responsible for delivering oxygen to all the cells of the body and removing carbon dioxide from tissues. Hemoglobin, a protein in red blood cells, carries oxygen. It is bright red when highly oxygenated and dark red when poorly oxygenated. Carrying oxygen is such a critical function of erythrocytes that they create more room for it by giving up their nuclei as they mature. Leukocytes and thrombocytes together make up only 1% of whole blood, but serve highly important functions. Leukocytes, known as white blood cells, are key players in the immune system, protecting the body from disease and infection. Different types of leukocytes defend against different threats, such as basophils, which release histamine during an allergic reaction. Thrombocytes, also termed platelets, initiate blood clotting to stop blood loss. Plasma is the liquid component, and it makes up the other 55% of blood. Plasma is unique because it contains no cells, but is composed of water, proteins, hormones, enzymes, and other dissolved gases and vitamins. Plasma is often donated by itself to provide these elements to patients with specific needs. It's important to note that not all blood is the same, and it can't all be donated to any patient. The ABO blood group system categorizes blood according to proteins called antigens on the outside of erythrocytes. They can have A, B, A and B, or no antigens at all.
The liquid plasma carries antibodies which react to antigens that don't belong in the blood. This means that the blood of each ABO group contains antibodies that will attack any antigen not already present. This is why the type of blood given to a patient must match their blood type. For example, when a patient with type A blood is correctly given type A blood, the anti-B antibodies cannot react with the A antigens, and the transfusion can be completed successfully. If a patient with type A blood is incorrectly given type B blood, their anti-B antibodies will bind to and attack the donor's cells, causing them to clump. This is called a transfusion reaction, or agglutination, and it can be fatal. Donated blood is carefully separated and sorted by type to prevent transfusion reactions. One other important distinction between blood types is the Rh factor. If a patient has the Rhd antigen, they're positive. If not, they're negative. Rh negative patients can donate to Rh positive patients, but positive patients cannot donate to negative patients. AB positive blood is known as the universal recipient and can receive blood from anyone. O negative blood is called the universal donor. Since it has no ABO antigens at all and is Rh negative, it can be given to anyone with any blood type. In emergencies where there's not enough time to check a patient's blood type, O negative blood transfusions can save lives. A blood transfusion is the process of transferring donor blood to a patient. Many different cases may call for a blood transfusion. Accidents involving severe blood loss, surgeries like organ transplants or heart surgery, chemotherapy, inherited blood disorders that interfere with clotting or production of hemoglobin, or anemia. Anyone can be affected by an illness or injury that requires a blood transfusion. However, donated blood has an expiration date. After 42 days, unused bags of blood must be thrown away. This is why donations from healthy patients are so vital. Let's take a closer look at the process of donating blood. You are a nurse working at a high school blood drive. You call your next donor and take a look at their patient information. Age, 18. Sex, female. Plans to donate whole blood today. You invite the patient to sit for a questionnaire and examination. First, you verify that the patient meets the minimum weight requirement for donation, 110 pounds.
You ask a series of questions pertaining to the patient's health history, including whether she has ever been exposed to hepatitis or HIV, and if she's had a tattoo or piercing within the past 4 months. She answers no for all. Next, you ask if she's feeling healthy and well today. She is. For the physical exam, you begin by taking her temperature, blood pressure, and pulse. Finally, you prick her finger and test her hemoglobin levels. You determine that your patient is eligible for blood donation today. You take your patient to a donor chair, next to which a bag and tube have been prepared. The donation bag has anticoagulants in it, so the blood doesn't clot once collected. You find the vein on the inside of the patient's elbow and insert the needle. Then, you attach the tube connected to the bag. The patient squeezes a foam ball to promote strong blood flow during the donation. Once the bag is full, you remove the needle from the patient's arm. You instruct her to apply pressure with a piece of gauze while you wrap her arm in tape. You check that she's not feeling dizzy or nauseous before directing her to the recovery area to replenish her fluids and blood sugar with juice and cookies. Her discharge instructions include avoiding strenuous activity for 1 day and who to call if she notices unusual symptoms during recovery. Likely, she will recover with no complications and can donate blood again in 8 weeks. The donated blood will be stored and may provide life-saving care to a patient in need. This has been a classic example of a blood donation. Thank you for watching this Brain Builder video. Please like and subscribe to our BodyViz channel, or if you are new at BodyViz, check out our other anatomy resources and schedule a demo at bodyviz.com.